The Center for Integrative Therapy and Training was founded in 1990 by Christopher Gordon with the aim of helping patients who suffer from acute and chronic musculoskeletal pain. Through clinical research, Christopher Gordon has devised an integrated, holistic yet scientifically validated method that can reduce pain and improve quality of life for his patients. In his high-quality intensive training seminars, Christopher Gordon teaches participants who are medical doctors, osteopaths and physiotherapists to combine and implement the techniques of myofascial trigger point release and autonomic self-regulation. Renowned guest speakers also share their expertise to ensure these seminars are conducted at the highest scientific level. Basic and advanced understanding of the myofascial network and the effect the autonomic nervous system has on the body, together with instruction on pain and stress biology, are among the fascinating topics covered. The grip sequences, which also use micro-movements for treating sensory-motor amnesia, help to make this therapy concept unique. Biofeedback technologies, heart rate variability training in particular, and specialized communication skills are incorporated as well. At the end of the seminar, participants take a written and practical exam and are then qualified to use this method to successfully treat patients that have acute and chronic pain.
I'm impressed by the didactic approach Christopher Gordon took to structuring the seminar and the speakers he chose, like Robert Schleip as a fascia researcher and Professor Nils Bierbaumer as a specialist in treating chronic pain. He really did a great job. I also want to mention Dr. Jan Fagerdes, senior physician at the Filder Clinic, and the staff at the University of Tübingen, who bring a very strong scientific background with them. Really quite unique.
A prospective, randomized and controlled study was conducted at the Filder Clinic under the supervision of Dr. Jan Fagerdes and Mr. Christopher Gordon, together with researchers at universities in Tübingen, Ulm, Florida and San Diego.
For me, the study conducted by Mr. Fagerdes and Mr. Gordon is of central importance because it is the first randomized control study that investigates myofascial therapies in line with clinical research standards and is bound to attract a lot of attention around the world.
The US professors Frank Andrasik and Richard Gewürz were key initiators for this study, whose purpose was to evaluate the effectiveness of this new integrative therapy, applying internationally recognized scientific standards. Initial results revealed that treatment involving the integrative therapy can offer patients greater relief than traditional methods.
I generally approve of well-controlled, scientifically based studies such as this because they allow us to interpret the results without having to take potentially disruptive and non-specific factors, such as placebos, into account. The results are then truly representative.
The study was conducted on over 100 patients. Results to date show that patients treated using the myofascial trigger point release techniques experienced significantly less pain.
The goal of this study is to adopt a highly scientific approach to determining whether patients suffering from chronic back pain can be successfully treated with myofascial therapy, especially when it is combined with heart rate variability training.
Professional musicians, dancers and corporate executives, amongst others, have turned to the Center for Integrative Therapy for advice and have participated in seminars on stress management and high-performance training in order to optimize their performance levels. Christopher Gordon, in conjunction with his highly qualified team, has found that patients who have not been helped by other therapies often respond to this form of integrative therapy. This integrative program, which combines traditional and advanced physiotherapeutic approaches as well as osteopathy in synergy with HRV training, has been refined on the basis of his clinical observations and research experience. The goal is to relieve patients from their pain patterns and restore their capabilities for generating health and well-being. so that they can focus on their strengths and achieve their life potentials, resulting in a greater sense of balance. Psychotherapy, deep relaxation techniques, gyrotonic coordination and fitness training complement this therapeutic concept, wherein treatments are developed and designed individually for each patient. At the Center for Integrative Therapy, patients learn how to practice self-regulation on a physical, emotional and cognitive level. Christopher Gordon follows a results-oriented method to achieve maximum effectiveness in treating chronic pain and stress symptoms, thereby improving his patients' quality of life.
My motivation and inspiration to treat patients over all these years with acute and chronic pain basically comes from the joy of knowing that our methods are effective and really do work. We are not able to help everybody, but we do have a very high success rate.
Center for Integrative Therapy in Stuttgart, Germany.